In this video, I'm going to show you how to release, using SMRT, spontaneous muscle release technique, the erector spinae muscles. So we're going to work in this video on the thoracic erector spinae muscles and on the lumbar erector spinae muscles. We'll leave the cervical muscles for another day, for another time. So the first release that we want to do is we're going to come from the top of the shoulder, and we're going to work with these fibers right in here, the fibers right next to the scapula. So all of those muscles right in here. I'm going to take my hand, I'm going to take it sideways. I'm going to put my finger right into the top of her shoulder. Now, I can monitor here. I can bring this other hand around. That's going to get in the way of your camera shot a little bit, so I'm just going to remove that. And I'm going to just push inferior with my hand on the top of her shoulder. So with my left hand on the very top of her shoulder, I'm going to push inferior down toward the hip. And I'm just going to hold. And again, if I wasn't on camera right now, I would reach around, or I would change my body position, and I would monitor on those upper erector spinae muscles, the muscles right next to or just medial to the medial border of the scapula. Okay, the next release that I want to show you is for those digitations of iliocostalis. So sometimes we know that as we're palpating, we come down, we find just like bands of tissue that we flop over like this. Okay, I want you to find the end of that particular digitation. So right about here, and then the bottom end of that particular digitation, which is right about there. Okay, so that's our line right there. So what I'm going to do is I'm going to put my fingers on either side of that, hook into the ribs, and then move those ribs toward one another. Okay, so let's see if we can get a better camera shot here if I move around this table. All right, so if this is our digitation, this is the top of it, and this is the bottom of it, I'm going to come just beyond that, hook into the ribs, and bring those ribs toward one another. That's going to shorten that particular digitation. And we want to hold everything when we're doing SMART for 20 to 45 seconds. So a minimum of 20 seconds. 30 is better. Sometimes 45 is necessary or feels really good. Okay, so the third thing that I'm going to show you, and I'm going to come back around this table here. This is one of our favorite ways to release the erector spinae muscles. So we have tension right in here, very close to the spine. I'm going to use her arm, and I'm going to bring her into a little bit of lateral flexion of the trunk. So I'm going to hook into her elbow. It's a very easy hold. I'm not gripping because there's no need for that, right? It's a very easy hold. We're going to move very slow, very small, and very controlled. What we don't want to do is pull her face right out of the face cradle. So I'm going to draw her arm out slightly and then down toward the hip. And I'm moving slow enough so that I can stop my movement as soon as I feel the pulse in my monitor hand. This is my monitor hand. Now, I chose to monitor right here in the middle of her back. I'm at about the inferior aspect of the thoracic vertebrae, maybe right around T10, T11. I could do this all the way down here in the lumbar erectors, but I could also do this up here. My movements would just be a little bit less. Okay, the last move that I'm going to show you for the erectors, we're going to do from the sacrum. so that we're really tying into that erector aponeurosis that comes from the bottom of the sacrum. I'm going to place my hand on the posterior aspect of the sacrum on her left side, and I'm going to move the sacrum superior and out toward her shoulder a little bit. So I'm kind of arcing it up the back. So we're moving it superior and out toward that shoulder a little bit. Just a little bit of a twist. Now I could monitor here as well, right? I could bring this hand in and monitor all along the erectors in here. I'm going to move that just so you can see a little bit better. Once in a while we have somebody whose sacrum is so tender that you can't put pressure into it like this. Another way to get this movement is to actually use the ischial tuberosity. So how do we find the ischial tuberosity? We come up the hamstrings, right? Make your way up the hamstrings until you run right into that gluteal crease. The crease at the bottom of that buttock, right? You're going to come right into the ischial tuberosity, and you can move that in an arc toward the shoulder. Now that's going to move the entire hip and sacrum superior and slightly lateral, which is what we're looking for. We want to make sure that we hold that for at least that 20 seconds. So we've given you 4 moves to use for the lumbar and the thoracic erectors. And again, we'll talk about the cervical when we get more into the neck. If, for some reason, this does not help with the erectors, make sure and check out the thoracolumbar fascia video or the sacrum videos. You might have to release the sacrum itself in order to get any release in the erector spinae.